Welcome to this webinar on radon in Kentucky. My name is Hardin Stevens, and I am the Senior Extension Associate of Healthy Homes and Communities with the Family and Consumer Sciences Extension State Office, which is located at the University of Kentucky. Just a brief explanation of Extension services in Kentucky. Extension services have an office in all 120 counties in the state. Extension services covers the following areas of programming: family and consumer sciences, 4-H and youth development, agricultural and natural resources, horticulture, along with community and economic development. The mission of Extension services is to make a difference in the lives of Kentucky citizens through evidence-based education, cutting-edge research, and community engagement. Jointly with our other land grant partner, Kentucky State University, Extension Services takes the university to the people in their local communities, addressing issues of importance to all Kentuckians. So why are we discussing radon in this webinar? According to the CDC, when you breathe in radon gas, which is naturally released from rocks, soil, and water, radioactive particles can get trapped in our lungs. Over time, these radioactive particles increase the risk of lung cancer and may take years before health problems appear. Radon is the leading environmental cause of any cancer. It is the second leading cause of lung cancer after smoking. People who smoke and are exposed to radon have a 10 times greater risk of developing lung cancer from radon exposure as compared with people who do not smoke and are exposed to the same radon levels. The following presenters will be discussing various aspects of radon, such as the effects radon can have on your health, how to educate yourself and raise awareness about radon, the steps you can take to mitigate your exposure to radon, and the resources and information regarding radon in Kentucky.
Hi, my name is Lindi Campbell. I'm a lung cancer patient and advocate. I'm a lifelong Kentuckian, and I also founded the nonprofit Breath of Hope Kentucky shortly after my diagnosis. I'm happy to be here today to represent a face and a story of lung cancer. I'm here not just for my family to help generate change for my disease, but I'm here for all the survivors and families who came before me, who did not live long enough to tell their story. Their memory matters, their journey matters. And I know, like I do, they feel our state matters. I've lived in Kentucky all my life, and I never knew I could get lung cancer. I didn't know there were other causes besides smoking. So when I was first diagnosed, I started doing more research on what had now become my disease to try to understand what caused me to get this disease and why didn't I know I could get it. The first thing I wanted to do was unite more communication, understanding, and compassion around lung cancer. I knew if I could get this disease, anyone could. And it seemed so unfair how those diagnosed were being perceived and blamed for their diagnosis. This type of blame and shame doesn't accompany other cancers, and the stigma was overshadowing conversations and education around other causes of lung cancer. I designed this logo around my advocacy in the early days of telling my story. I wanted to encourage people to fight harder to help improve the survival statistics around lung cancer by erasing the stigma and replacing blame and shame with conversations that included other causes of the disease, improving funding for more research and treatment options, and shift our attention to what these patients and families need to move forward and live longer after being diagnosed. At the time of my diagnosis nearly 6 years ago, Kentucky ranked #1 for lung cancer cases and deaths. Yet I wanted the state I lived in and loved my entire life to be known for something bigger and better. I wanted us to receive attention for how hard we fight to improve the statistics around lung cancer in our state, because our citizens deserve better. We've been talking about one cause of lung cancer for decades, yet our citizens need to also be well informed about other causes and understand how to protect themselves from exposures to toxins that damage cells in the lungs that can also lead to lung cancer. It was too late for me. Toxins I was exposed to over the years, despite having never smoked, entered me into a lottery no one ever wants to win. But I knew because of my story, I at least had a chance to use my voice to help others. You'll hear a lot about science and statistics around the topic of lung cancer today. But since I was first diagnosed, I've said if the people hearing about the topic of radon don't truly believe it can happen to them or someone they know and love, they're less likely to pay attention and feel called to action. The image on the left is the first time the nodule was viewed on a CT scan in my lung. As you can see from the middle image, it closely resembled what matched the image of what was considered to be a cancerous nodule. However, it would take more than 2 years before I received surgery because I was not considered high risk for getting lung cancer. It's important the medical community and patients realize that there are other dangers, as in my case, like radon and secondhand smoke that can lead to this disease. The loneliness and the fear that accompanies this diagnosis will take its toll if you don't find your voice and claim your story. I've always been an active and healthy adult. I never really thought much about cancer at all, and I especially never thought about lung cancer. I was the baby of the family. My parents both lived into their mid-80s. 2 of my sisters have also passed away, but neither passed away from cancer. The photo on the far right was the last time we were all together, and this picture was taken on the steps of my childhood home. We were a big family and didn't have a lot of money, so we spent many days and nights hanging out in the basement of our childhood home. We had a back part of the basement where we would roller skate and where our laundry room is located. We would also gather in a small den area to watch TV and entertain friends. And then there was the bedroom. We would all wait for a chance to call our own. When I was 13 years old, that bedroom became mine for the next 8 years until I was the last sibling to leave the nest. During the years growing up in that home, we were all exposed to very high levels of radon, and none of us ever knew until I was diagnosed. My mom still lived in that childhood home at the time of my diagnosis, so we had a long-term test placed in the basement of her home. As you can see, it tested over 5 times the level the EPA recommends placing a mitigation system in your home. So my entire childhood, I spent my days breathing in secondhand smoke and my nights breathing in radon gas. The place where I should have felt the safest was what we now believe is responsible for lung damage that is likely the cause of my lung cancer diagnosis. As with any cancer diagnosis, we can only connect science with what makes the most sense when it comes to causes of varying types of cancer. And in my case, all you have to do is connect the dots. These are just a few of the Kentuckians I've met since I was diagnosed with lung cancer, who have also been diagnosed and were not considered high risk for getting the disease. They too wonder why. All of these individuals have stage 4 lung cancer. They live all across Kentucky. They either grew up here or live here now. And they, like me, just wonder why somebody's not doing more to educate us on these other causes. I was fortunate enough to know my background and go back and trace the steps of where my exposure might have happened. But with something like radon, the problem is a lot of people have moved. They don't live in those homes anymore. They don't know, could it have been a public building they were in, a place of work, a place where they went to school? And that's why it's so important that we figure out how we're going to educate our citizens on these dangers, and not just educate them, but also fight for protecting these spaces so they are breathing safe air that won't lead to these cancer diagnoses. So I ask you today, let's all work together to make sure what we do know reaches those who don't. Because I think Kentucky is worth fighting for. Do you?
Welcome to this What is Radon and its Effects in Kentucky webinar, provided by the University of Kentucky College of Nursing and Breathe, bridging research efforts and advocacy towards healthy environments. My name is Kyle Kuykendall. I'm the Radon Program Coordinator with Breathe. Today, we'll discuss the following topics. What is radon? Radon exposure, radon, tobacco smoke, and health risks, radon variability, and radon testing and mitigation. Radon is a colorless, odorless, and tasteless gas that is the product or daughter of the naturally occurring radioactive decay of uranium and radium. This breakdown occurs in the soil and rocks in the crust of the earth. Uranium is a normal part of the Earth's crust, so it's natural for there to be some radon in the soil and rock. Because it's a gas, it easily traverses through the soil and enters the home. Once released, radon accumulates in enclosed spaces such as residential homes and office buildings, where it goes unnoticed unless people specifically test for it. Radon exposure is a significant health concern because it causes no immediate symptoms, yet is the second leading cause of lung cancer. Radon can enter any type of building. This means that homes, apartments, offices, schools, and childcare facilities can all be affected. There is significant focus on residential radon because people spend most of their time at home and about 70% of their time indoors. People who are most susceptible to the adverse effects of radon exposure tend to spend even more time indoors. It follows that people are most likely to be exposed to radon in their own homes. Due to its undetectable nature, testing for radon is the only way to know the radon level of a home or workplace. Radon exposure is primarily associated with lung cancer. Radon induces lung cancer of all histological types, including small cell carcinoma, adenocarcinoma, and squamous cell carcinoma. Radon is the leading cause of lung cancer in those who have never smoked, and the second leading cause of lung cancer after smoking. Radon accounts for approximately 10% of all lung cancer cases, resulting in 15,400 to 21,800 cancer deaths in the U.S. annually. However, some scientific estimates suggest the total number of radon deaths per year may approach 45,000. To put these figures in perspective, 21,000 deaths per year is more than 7 times the number of deaths caused by home fires, yet most homes are equipped with smoke detectors. Radon can attach to dust particles or smoke in the air and be carried into the lungs. When inhaled, radon decays into radioactive products that interact with the mucus lining of the lungs and release ionizing alpha particles into lung tissue, causing damage at the cellular level. Exposure to even a single alpha particle can damage DNA. When cells have DNA damage, they become vulnerable to develop into cancer, particularly if introduced to other carcinogens like tobacco smoke. Multiple factors contribute to the risk of developing radon-induced cancer. Exposure levels over time are a predominant risk factor. Additionally, some populations are particularly susceptible. These include people with specific genetic makeup, children, people who smoke, and those exposed to secondhand tobacco smoke. Secondhand smoke particles linger in the air and are small enough to be inhaled directly into the lungs. Radon byproducts have a static charge and are attracted to secondhand smoke particles in the air. The combined interaction, or synergy, that exists between tobacco smoke and attached radon particles leads to a risk of lung cancer that is increased by a factor of 10 when exposed to both carcinogens. Anyone who resides in or works indoors may be exposed to elevated levels of radon. Those exposed to higher radon levels have more opportunity for DNA mutations and the formation of cancer. Because radon is invisible, odorless, tasteless, and without any immediate health effects, exposure often goes unnoticed unless homes and buildings are tested. Anyone may be chronically exposed to radon without their knowledge. Testing for radon is simple and easy, and it's recommended by the EPA. Multiple types of radon test kits are available for the consumer through local health departments, hardware stores, or online dealers, and professional radon measurement is also typically available in most areas. 4 rural Kentucky counties, Christian, Logan, Pulaski, and Rowan, currently have digital detectors available to be checked out at local county libraries through Breathe's Radon on the Radar library loan program as well. The EPA recommends testing the lowest lived-in level of a home. For example, the basement if it's used at least 8 hours a week, otherwise use the first floor. A test kit should be used in a room that is used regularly, but not in a kitchen or bathroom, as these spaces may have high humidity that could impact your radon levels. Charcoal-based short-term kits typically only run a few days and are then mailed to a lab for analysis. Digital, continuous monitors are capable of testing for extended periods of time, which makes them inherently more accurate as they are able to take into account daily and seasonal changes in pressure and weather, although they are more expensive. Consumers are recommended to begin with a charcoal-based kit and escalate to a continuous monitor or professional measurement as needed, based on the radon levels as compared to the EPA and World Health Organization action levels, discussed in the following slides. Radon is measured in radioactive units per liter, called picocuries per liter. The average American home measures about 1.3 picocuries per liter, while the outside air is just 0.4 picocuries per liter. The EPA suggests removal of radon through remediation, called mitigation, at 4 picocuries per liter and above. This is called the action level. Approximately 7% of homes in the US measure at or above the EPA action level, but in some regions this can be much higher. The World Health Organization has proposed an action level for radon mitigation at 2.7 picocuries per liter. This is 33% lower than the EPA's action level of 4 picocuries per liter. According to the American Association of Radon Scientists and Technologists, or ARST, 2022 report card, 44% of buildings in Kentucky have a radon exposure potential equal to or greater than the EPA action level. If radon levels are under 2 picocuries per liter, the EPA recommends testing periodically, about every 2 years, and retesting if living patterns change, like if the basement is converted to a family room or a bedroom, or if the home is changed, for example, the addition of a sump pump or a different HVAC system, and every 2 years after mitigation to be sure that the radon levels remain low. Average radon levels vary from home to home and building to building, and they also differ from one geographical location to another. Therefore, geographical location is an important factor contributing to potential for radon exposure. Bedrock and soil in different regions have different levels of uranium and therefore produce different amounts of radon. A recent case control study found that the odds of lung cancer increased by 11% for every 10 years lived in locations with geological formations associated with radon. Because radon entry into a home or other building is dependent on these individual features, radon levels in neighboring homes or buildings differ. Therefore, if one home tests low for radon, this does not mean that neighboring homes would also test below EPA action levels. High radon levels can be found in every state, and they vary by regions within a state. The figure on the following slide provides information on the variability of radon risk potential in Kentucky. To learn more about radon in a particular state, contact your state radon office. The Kentucky Geological Survey and the University of Kentucky College of Nursing BREATHE program combined more than 70,000 home radon test kit results with Kentucky's digital geological map coverage to produce this indoor radon potential map. Note that radon potentials are based on geologic formations and are therefore continuous and do not end with geographical boundaries like state or county lines. This is more useful than the static boundaries of many older radon maps. However, this map is not intended to be used to determine if a home in a given potential area should be tested for radon. Homes with elevated levels of radon have been found in all five levels of radon risk potential. Living in a region that is represented by low average radon levels does not mean that any particular home or building is below the actionable level of 4 picocuries per liter. Although some regions appear to have average radon levels below 4 picocuries per liter, this may be misleading because A, the radon values may not represent the geologic variations in the region, and or B, the radon values may be artificially low due to low testing rates in the area. Because radon accumulates indoors and there are differences in the structure of every home and building, there's no way to be sure of radon level without testing. A recent analysis of over 54,000 short-term radon test kits collected over a 21-year period from 1995 to 2016 found that only 13 out of every 10,000 homes in Kentucky has been tested for radon. This is a fraction of 1%. It's recommended that all homes and buildings be tested every 2 years. Mitigation is the act of removing radon from beneath the home or building, preventing intrusion and venting it to the outside air. Mitigation works. It can reduce radon levels by up to 99%. In general, mitigation consists of digging a small pit below a home or in its foundation and inserting a PVC pipe into the pit. The pipe will run outside the home where it will be connected to a fan. This fan creates a soil suction, which will draw radon from the soil directly into the pipe without it ever entering the home. From there, the pipe then runs up and above the building's roofline where the radon is vented to dissipate in the outside air. If a home tests at or above the EPA action level of 4 picocuries per liter, homeowners are not required to fix their home. However, by law in Kentucky, contractors who perform radon mitigation must have been through a special training program and pass a test to become certified. The potential for high levels of radon in new homes and buildings can be reduced by incorporating a radon-resistant new construction, or RRNC, passive system during construction. This means that the pit and PVC pipe are placed at the time of the home's construction, and a fan may be added at a later time, usually in an attic, should it become necessary. The addition of a fan would then make this an active mitigation system. This approach also increases the energy efficiency of a home heating and air system compared to mitigation systems, which pump heated and cooled air outdoors. Additionally, RRNC reduces moisture and the potential for mold. This type of system is much less expensive than mitigation after the construction of the home. Several policies are in place in Kentucky to protect homeowners and promote radon control. In 2017, a radon contractor regulation was passed stating, any person or business entity conducting radon measurement, mitigation, or laboratory analysis must be certified by a radon proficiency program recognized by the EPA, follow standards, and register with the state. This regulation is intended to ensure consumer protection by requiring radon contractors to be specially trained and certified in installing radon mitigation systems. In 2019, an administrative regulation was passed to amend the Kentucky Seller's Disclosure of Property Conditions form to add a radon awareness statement. The short statement is intended to educate the buyer of the possibility of radon being present in the home and provides a link to learn more about radon. Sellers are also required to disclose if any radon testing or mitigation has occurred at the property. Real estate transactions are seen as prime opportunities to test homes for radon, and if high levels are found, the cost of mitigation can be negotiated in the price of the home. To summarize, radon is a natural, deadly gas that infiltrates indoor areas. It's the second leading cause of lung cancer and works in synergy with tobacco smoke. Testing for radon is simple and easy. Action levels defined by health organizations help determine when to take action to fix radon issues. And mitigation is effective at removing radon and may be done before or after the construction of a home. In closing, if you'd like to learn more about radon or would like Kentucky-specific materials you can use to educate others, visit our Breathe website. In addition to the radon data by county infographic, we have information on the library loan program, radon and secondhand smoke, radon in children, a radon comic book and coloring book, as well as education for healthcare providers and policymakers. Thank you for your attention.
Everyone, and I am Clay Hardwick, and I am the state Radon program coordinator, and I'm in the Kentucky Department of Public Health. I am glad to have the opportunity to be here to explain how Kentucky is, very briefly, explain how Kentucky is addressing kind of radon with the state indoor radon grant funds that it gets. I want to cover and discuss briefly some just general background on the state indoor radon grant, the responsibility of the state radon coordinator, the main areas of outreach, kind of how we are set up, and just a little bit towards the end on our poster and video contest that was recently done in 2022. So outreach and education through the federal funds, the state indoor radon grant money that comes out of Washington, that covers most of the U.S. with the exception of a few states, which would be Arkansas and Louisiana. So we have a pretty good amount of coverage with the pot of money that is given by Congress. And this all started back in 1988. The Indoor Radon Abatement Act was the key kind of foundational act that set up money to go out towards radon education. It started out with an annual appropriation of $10 million. That money is not consistently appropriated every year, and it's not a large amount of money, but it is distributed out through the Environmental Protection Agency, and then that goes on out to 10 regional offices. They oversee the money and the performance. They kind of monitor the grant, and that's the general setup we have there. So just to have a diagram showing that a little bit more clearly, we have the headquarters of EPA headquarters getting money from Congress. They then moved that out to about 10 regional offices. Kentucky is in Region 4, and with our pot of money, we usually distribute that out around 45 counties. We do not have an entire state coverage with the money that we receive. So each state program usually assigns a radon coordinator, either full-time or part-time. And the responsibilities with that position would be applying for the grant funding, roughly on a cycle of about every 3 to 5 years. Then they're setting up the partners that they work with within each state, and they just work with those partners to help spread the education of radon testing and mitigation primarily. They do what they can to connect partners between each other. In years past in the state of Kentucky, we have had a coalition. These things are not always super easy to maintain, but we make the best efforts on that, and the money has a lot of bearing on that. But anyway, the coordinator also has to monitor the grant requirements and make sure that everyone stays up to speed on that. And then the grant is supported by a work plan that gets approved by the EPA regional office. And of course, we want to send in reports to them and financial reports pretty regularly. So within Kentucky, we've kind of got some short-term, long-term planning that stems around 6 kind of core areas. They get revised and reviewed every few years. We have been kind of working out of these 6 areas for probably the last 6, 7, or 8 years. So we continue to try to promote awareness of radon out to the medical community. We want to include radon in state cancer control plans. And that is a coordination effort through the Centers for Disease Control. But Kentucky has been able to maintain language in the cancer control plan and have good involvement with the consortium for several years. Then we try to get radon awareness, messaging and stuff out to the real estate community. We also work to get education out if we can, really more along the lines of indoor air quality education, I could say, to radon schools and districts and stuff. It's an area that we are working hard to improve on. That's an area that is not easily addressed probably as other areas, but we also work in continuing education and just trying to set up courses that would be beneficial to our existing, network of partners. We try to do that, and just out to the public as well, too, as best we can. And we work to include radon reduction strategies in state and local building codes if we can do that. So as it stands right now in our Kentucky outreach, we have about 3 arms or legs for outreach. We have our state office, then we have our university contracts and our relationships to our local health departments. And so I've just kind of listed out what I perceive to be the key components of each of those groups. And under the state umbrella or whatever, there we work towards awareness through our poster contest. We try to plan out a Radon Action Month, which is in January of each year. Participate in speaker events and just coordinate training events. And we've got our website out there that has our free kit offer, and that's pretty common among a lot of the state programs. And then with our university umbrella, they provide so much in the way of research and creating great resources for us in that way, and information flow through what they do there. They do citizen science projects, a lot of radon mapping, specific outreach to health professionals, and also to county. We have a network of county extension agents now, so we are happy to get information out to them and have them help us along with our outreach. And of course, their website is just a great amount of information there to tap into for ongoing education. Our local health departments are just out there. We have about a 45 county coverage, as I mentioned. Some of those are districts, and some of those are independent county health departments. And they help us with getting access to free test kits and just having a local contact there, really, to be there available for speaker events and just to explain to people the process of mitigation. And then if they can't, they can turn that back up to me at the state level. But they kind of are creative and have various things that they will do, and they will sometimes work in with schools, or they will work in with libraries, but and they always try to participate heavily in Radon Action Month and getting out the message through different routes. And these days, that's usually social media and things along those lines. So kind of closing out here, kind of like I mentioned before, the radon money is not completely consistent all the time. It fluctuates. That's the behavior of many grants, federal grants out there. We try our best to always maintain a poster contest. We've done that for years. We were able to do that in 2022. And so just to recap that a little bit, we started out with a newsletter, some email subscriptions to schools, and then got the message out through our partnering local health departments. And this past year, we received around 16 poster submittals. We then went on to our voting and then selected out our winners. And the video contest was a new thing for us. We had been wanting to do this for some time. We didn't receive as many submissions as we would have liked, but we got 7 videos total, and then we voted out on those and selected out our winners. And so this is a closer up view of the artwork of the students. We're always excited to see what they'll do, and I think they always do a good job. And so we have that artwork there, just a few pictures of the winners, first and second place. We didn't get the photo release or whatever in time on the third place winner, but and this is some of my colleagues in there as well. The video contest, these are the names of the first, second, and third place winners that we had, and the
I'll take poison gases for 600. The number 1 deadliest gas in the United States. What is radon gas? That's correct. Radon is a colorless, odorless gas that naturally forms underground and can seep into buildings. It is the second leading cause of lung cancer deaths in the United States after smoking. Learn more about the dangers of radon, forms of mitigation, and how to protect your family and home. Visit epa.gov/radon for more information.
The case of the silent killer. I got a new lead on our case. The killer is tasteless, odorless, and colorless. It's the second leading cause of lung cancer in the United States, causing over 21,000 deaths per year. It comes from the natural breakdown of uranium in soil, rocks, and water, and can even be found in your house. Oh, I know what it is. It's radon. Protect yourself and your loved ones from radon. Request a free radon test kit today.
get more submittals in 2023. So just wrapping up, here's just a few kind of photos at the end of the winners for the video contest, and me and my colleagues on the second place winner here they were here in Franklin County. So that's about all I'm going to kind of elaborate on today with the time I have available, and good to be here alongside everyone else. Thank you.
As I mentioned in the introduction, I am with the Family and Consumer Sciences Extension. If you are interested in learning more about radon in your community, I would encourage you to contact your local county extension office. The local agent has access to radon information that can be presented to community groups such as homeowners or neighborhood associations, home builders, contractors or subcontractors, real estate agents, local chamber of commerce, school officials, and faith-based communities. If the local agent is not able to answer all of your questions regarding radon, other possible resources for you to contact are your local health department, Clay Hardwick with the state radon program in Frankfurt, or myself. I would like to remind everyone that January is Radon Action Month, so be on the lookout for information and social media posts regarding this. And please help us to spread the word regarding radon. Thank you to all of today's presenters for making this program possible.